Hello everyone, welcome back to another video from me. In today's video, I have 100 review questions and answers for the MRI Registry Exam. This is for ARRT and ARMRIT students. Just make sure that you do watch to the end of the full video because the information can be extremely helpful to help you pass your test. So if you can, just try to watch the whole video to help you study. All right, so since I do have my certifications through ART, this is the outline that I'm using whenever I am making these questions, as well as for you to study. And it's just broken down to how many questions will be asked in each category. If you haven't seen this already, if you are studying for your ARMRIT exam, the information can still be used the same. Everyone uses the same book. Everyone uses the same questions and answers, depending on where you find yours from. So this information can help both people. The question is just for both registries. All right, so please read the disclaimer because I always get these questions. So these practice test questions and answers are made to help you all pass your registry exam. Due to the registry board's copyright law, these questions will not appear on your registry examination in this exact wording, but they are designed and constructed to test your knowledge in order to help you pass your registry exam. Since it takes time, effort, and research for me to make these questions for you all, I am going to read each question, answer choices, and the correct answer to avoid anyone from reusing my material and voice. If the audio bothers you, please mute the video. Being so that these questions are available to you for free, could you please like, subscribe, and share the video? I would greatly appreciate it. Thank you all for watching and good luck on your registry examination. Please give the video a thumbs up or leave a comment if you would like for me to do a part 2 to these 100 questions and answers. And I do have more of these videos in my MRI registry playlist, so you just have to click on the playlist. I will also link it to the end of the video for you all. All right, so this is just quick tips for you. Make sure that you are watching the full video. If you are skipping around or, not watching all of it, you're going to miss like important information because I do have 100 questions in this video and it's all on patient care, anatomy, physics. If there are any questions that you have not noticed in this video, it's because that I have probably already made it in another video. So that's why I'm saying you just have to watch to the end to help you study. And these questions are new. I make all the questions new. So if you can, just please like the video for me. It took me probably 8 to 10 hours. It took me at least 2 to 3 days to make these questions because I make my own questions. You won't find these in a book, and also doing this around my work schedule. So anyway, could you please give the video a thumbs up for me and we will get started with the questions. All right, so like I was saying, I am going to read the questions, the answer choices, and give you time to think about the answer. This is just something that I like to do so that people are not reusing my content as their own because it did and it does take a lot of time and effort to create these videos for you all because I'm doing it around my work schedule and I'm doing it for free. I'm just sitting down making these questions for you. So if you can, just please like the video. Like I was saying, if I'm going too fast, you can pause it or rewind it and write down wherever you stopped on or however many questions that you got wrong so that you can just come back and just restudy the questions. And other than that, we'll get started. And if at some point of the video, if you see that like the slides are like a little jumpy, it may be because I had to edit something out or add something in, or maybe I took a break because this video is going to be long. Just fair warning, the video will be long, but you can always just come back to it or write down the number that you stopped on, then just come back. All right, so here we go. Question 1. What is the recommended dose of Dotarim for adult and pediatric patients by body weight? A, zero point 0.1 milliliter per kilogram. B, 0.2 milliliter per kilogram. C, 0.3 milliliter per kilogram, D, 0.4 milliliter per kilogram. All right, the correct answer is B, 0.2 milliliter per kilogram. The recommended dose for dotarum in adult and pediatric patients is 0.2 milliliter per kilogram of their body weight. And then this information was found on this website. And you can see on this site, this is the information where I got the recommended dose for dotarum. You can also see, according to this website, which is it's saying that it's accessdata.fda.gov, but you can see like the pounds, the weight, how many milliliters you should be giving each patient. So you can use this for your reference. Question 2. Which MRI zone can the general public walk freely in? A, Zone 1, B, Zone 2, C, Zone 3, D, Zone 4. All right, the correct answer is A, Zone 1. Question 3. Devices or implants that can be safely scanned in MRI under specific conditions is called A, MRI compatible, B, MRI conditional, C, MRI safe, D, MRI unsafe. All right, the correct answer is B, MRI conditional. So a lot of people get MRI compatible and MRI conditional confused. So just make sure that you know that it is MRI conditional. Question 4. A bird cage coil in MRI is an example of A, array coil, B, extremity coil, C, surface coil, D, volume coil. All right, the correct answer is D, volume coil. A birdcage coil in MRI is a volume coil in a radio frequency RF resonator which provides high quality MRI images by producing a homogeneous and circularly polarized B1 magnetic field. And I forgot to mention, sorry if you hear any background noise. I want to apologize in advance. I'm not home by myself at the moment, so I'm trying to get this video out because a lot of people have commented and they told me that they have their exam coming up. So that's if you hear anything. Question 5. Large coils provide A, low SNR, B, high SNR, C, no effect in SNR, D, small coverage. All right, the correct answer is A, low SNR. Large coils provides a large coverage but does not provide great signal to noise or SNR in comparison to smaller coils. So keep that in mind. All right, so if you are finding my video helpful, could you please like, share, and subscribe for more videos? Also, leave a comment down in the comment box if you would like more videos like this. I do have smaller videos where I'm just asking like 20 questions, 30 questions, or 50 questions if you want to see something in a smaller amount. And all of the questions are different, so just click on the playlist that I will put at the end of the video to get to those. Question 6. A fringe field strength of blank or greater must not go outside of MRI zone 3 or MRI zone 4. A, 2 Gauss, B, 3 Gauss, C, 4 Gauss, D, 5 Gauss. All right, the correct answer is D, 5 Gauss. Question 7. Which anatomy structure is the arrow pointing to? A, medulla oblongata, B, pons, C, spinal cord, D, thalamus. All right, the correct answer is B, pons. Question 8. Which anatomy structure is the arrow pointing to? A, medulla oblongata, B, pons, C, spinal cord, D, thalamus. All right, I'm sure this is an easy question for you all. So the answer is C, spinal cord. And just in case you, someone probably didn't know the question, so that's why I just threw that out there because I do have people who watch my videos that haven't even started their program. They're just trying to get ahead. So if some of the questions seem easy to you, that's great. You've been studying, but I also throw in harder questions as well. Question 9. A blood oxygen level of 80 is considered A, bradycardia, B, hypoglycemia, C, hypotension, D, hypoxemia. All right, the correct answer is D, hypoxemia. Normal oxygen levels are between 95% and 100%. Question 10. How many times does Nyquist's theorem must be sampled to avoid aliasing artifacts? A, once, B, twice, C, 3 times, D, 4 times. Right, the correct answer is B, twice. Nyquist's theorem states that a signal's highest spatial frequency must be sampled at least twice to avoid aliasing artifacts. Question 11. A pulse of 120 for a child will be considered A, bradycardia, B, hypertension, C, normal, D, tachycardia. All right, the correct answer is C, normal. Let me know in the comment box how many of you all gotten the question wrong. That's why it's important for you just to read the question from front to end. So let me know if you got that one wrong. But the normal pulse rate range in children is 70 to 120 beats per minute. Question 12. How many hours should a patient wait before receiving more MRI contrast? A, 30 minutes, B, 4 hours, C, 12 hours, D, 24 hours. All right, the correct answer is D, 24 hours. So it is that patients with normal kidney function must wait at least 24 hours before receiving more MRI contrast. This may vary at different facilities. I know the facilities that I work at, if you give a patient contrast, you have to wait 24 hours. And then I've also checked with someone else at their job, and they said they wait 24 hours as well. So um, just go by what your facility and radiologist does. But like I was saying, for mine is 24 hours that they must wait. Question 13. Which anatomy structure is the arrow pointing to? A. Cerebrum. B. Cerebellum. C. Pons. D. Thalamus. All right. The correct answer is C. Pons. Question 14. Which cranial nerve controls the movement of tongue muscles for speech and swallowing? A. 9. B. 10. C. 11. D. 12. All right. The correct answer is D. 12. Cranial nerve 12 or hypoglossal nerve controls the movement for the tongue muscles, which is for speech and swallowing. Question 15. The most commonly used unit of measurement in MRI is A. Centimeters, B. Millimeters, C. Radio frequency, D. Tesla. Right. The correct answer is D. Tesla. All right, so if you all are enjoying this video, could you please give it a thumbs up or leave a comment to let me know if you want me to do another part 2 with 100 more questions, or if you are good at 50. I know 100 probably can seem a little overwhelming, but I had someone who left me a comment under one of my posts and was like, the more questions, the better. So it is easier for me to know what all I'm putting in a longer video compared to 20 question video. So you can always just pause the video and just pick it back up if it is long. But yeah, I will link my playlist to the end of this video for you all to check it out. So just let me know in the comment box, how many questions do you want? Question 16, true or false question. K-space is the image. Is this A, true, or B, false? All right, the correct answer is B, false. K-space is not the image because it does not have the correct spatial locations and must be transformed by a mathematical location called the Fourier transform. So I'm not saying that your test will have true and false questions. I don't know if it will or if it won't, because I do have international students watching my videos as well from other countries and all over the place. So I'm not saying that yours will have true or false or it won't, but this is just another way to kind of help you understand the information better. So if that makes sense. Question 17. Which data does the central portion of K-space have? A, high kilovoltage peak. B, high resolution. C, low resolution. D, low signal amplitude. All right, the correct answer is C, low resolution. The central part of the K-space has low resolution data and high signal amplitude. Low signal amplitude and high resolution is in the outer portion of the K space. Kilovoltage peak, also known as KVP, is a terminology that is used in diagnostic X-ray, mammography, and computed tomography. So I want to throw that out there for the high kilovoltage peak, just in case I have ARMRIT students who have not gone through X-ray. So at least they can know that the high kilovoltage peak is something that we use in X-ray if you have your ARRT X-ray or CT certification. Question 18. Which data does the outer portion of K-space have? A, high signal amplitude. B, low kilovoltage peak. C, low resolution. D, low signal amplitude. All right, the correct answer is D, low signal amplitude. The outer part of the K space has high resolution and low signal amplitude. Question 19. Which cranial nerve is the sense of smell? A, 1, B, 2, C, 3, D, 4. All right, the correct answer is A1. Cranial nerve 1, also known as the olfactory nerve, is for the sense of smell. Question 20. Which zone is the MRI scanner located in? Like I was saying, this may be an easy question for some of you all, but for people who have not started MRI school and is looking ahead, they can benefit from this question. A, zone 1, B, zone 2, C, zone 3, D, zone 4. All right, the correct answer is D, zone 4. Question 21. The main magnetic static field is A, B0, B, RF, C, TR, D, TE. All right, the correct answer is A, B0. Question 22. Which of the following does MRI use? A, gamma rays, B, ionizing radiation, C, non-ionizing radiation, D, sound waves. All right, the correct answer is C, non-ionizing radiation. MRI uses non-ionizing radiation. Nuclear medicine uses gamma rays. Computed tomography, also known as CT, uses ionizing radiation, and ultrasound uses sound waves. Question 23. Which anatomy structure is the arrow pointing to? A, basilar artery. B, carotid bifurcation. C, external carotid artery. D, subclavian artery. All right, the correct answer is A, basilar artery. Let me know in the comment box if you all are good on your arteries in the brain and neck, because those are very important. Question 24. Which anatomy structure is the arrow pointing to? A, basilar artery. B, carotid bifurcation. C, external carotid artery. D, vertebral artery. All right, the correct answer is D, vertebral artery. Question 25. Which anatomy structure is the arrow pointing to? A, basilar artery. B, common carotid artery. C, external carotid artery. D, subclavian artery. All right, the correct answer is B, common carotid artery. Question 26. Which anatomy structure is the arrow pointing to? A, basilar artery. B, common carotid artery. C, external carotid artery. D, subclavian artery. All right, the correct answer is D, subclavian artery. The arrow is pointing to the left subclavian artery to be exact. So make sure that you know your left from your right. Question 27. Which anatomy structure is the arrow pointing to? A, basilar artery. B, external carotid artery. C, internal carotid artery. D, subclavian artery. All right, the correct answer is C, internal carotid artery. Question 28. I believe I'm almost done with the arteries for now. Which anatomy structure is the arrow pointing to? A, basilar artery. B, external carotid artery. C, internal carotid artery. D, subclavian artery. All right, the correct answer is B, external carotid artery. Question 29. Which landmark does the common carotid artery bifurcates into the internal carotid artery and the external carotid artery? A, C1 to C2. B, C2 to C3. C, C3 to C4. D, C4 to C5. All right, the correct answer is C, C3 to C4. Question 30. A safety concern with gradient coils is A, acoustic noise. B, artifacts. C, burns. D, overheating. All right, the correct answer is A, acoustic noise. So acoustic noise is sound. So the sound from the MRI machine during the actual MRI scan is a safety concern with the gradient coils. That's why we always offer earplugs. I've had people who said that they don't offer earplugs if they have a patient who comes in deaf or say that they're deaf. So here's my take on this. Offer the patient earplugs because what if this is a mystery shopper and they're not deaf, but they're trying to see if you're still going to offer um, earplugs to them? So I always just offer earplugs, and if I said hearing aids, my apologies, but I meant to say earplugs. That's if I said hearing aids instead. But anyway, offer earplugs because you supposed to. It's by law, and I haven't read anywhere where it say if the patient is deaf, don't give it to them. But what if the patient isn't deaf? What if they're just saying that they are? You know, but I don't know. Just always offer your patients earplugs. All right, so how are you doing on the questions? How long do you plan to study for your MRI registry? Let me know down in the comment box. I'm curious to know how many people are taking their exam, if it's coming up, how long do you plan on studying? I do have like a studying outline for you all to look at if you want to take a look at that. So all of that will be linked at the end of the video for you to click on in my playlist. Question 31. A vital sign reading of 160 over 90 is an indication of A. Bradycardia, B. Hypotension, C. Hypertension, D. Tachycardia. All right, the correct answer is C. Hypertension. A normal blood pressure range is 120 over 80. Question 32. Which weighted image is shown below? A. T1 weighted, B. T2 weighted, C. Flare, D. Stir. All right, the correct answer is the T2 weighted image, and you can tell because the CSF is white, so that's like a indication of you telling that it's a T2 weighted image. Question 33. A typical TR range for a T1 weighted image is A. 200 to 600 milliseconds, B. 300 to 700 milliseconds, C. 400 to 900 milliseconds, D. 500 to 1,000 milliseconds. All right, the correct answer is B, 300 to 700 milliseconds. So this number may vary depending on what facility you're working at and the machine you're using, but try to get in the habit of seeing your TR ranges on the machine, your field of view, your phase over sampling, your averages if you're using a Siemens scanner, because when you see those parameters on your scanner, it can help you out a lot whenever you're taking your test because you can see, okay, I'm changing the field of view. This is doing this to the signal, or this is doing that to that. So it's easy to tell whenever you are actually working on it, looking at it on the machine that you're using. Question 34. A long TR and short TE will give a or an A. T1 weighted image, B. T2 weighted image, C. Proton density weighted image, D. Stir image. All right, the correct answer is C. Proton density weighted image. Question 35. A long TR and long TE will give a or an A. T1 weighted image, B. T2 weighted image, C. Proton density weighted image, D. Stir image. All right, the correct answer is B. T2 weighted image. Question 36. A short TR and short TE will give a or an A. T1 weighted image, B. T2 weighted image, C. Proton density weighted image, D. Stir image. All right, the correct answer is A. T1 weighted image. All right, so leave me a comment. I know I have a lot of breaks in here, but this is kind of to keep you all from dozing off on the video because I know it's probably getting a little bit long, but at least the information in here is important and can help you on your test. But please leave me a comment and let me know which area or category you think you'll struggle the most in. Is it patient care? Is it physics? Is it anatomy? Anatomy, just let me know in the comments so that I can make more videos or more questions on those topics. Question 37. TR controls A, tau, B, T1 contrast, C, T2 contrast, D, T2 decay. All right, the correct answer is B, T1 contrast. Question 38. TE controls A, the gradients, B, tau, C, T1 contrast, D, T2 contrast. All right, the correct answer is D, T2 contrast. Question 39. The amount of T2 decay is controlled by A, echo train length, B, TR, C, TE, D, TI. All right, the correct answer is C, TE. Question 40. Which anatomy structure is the arrow pointing to? A, cerebrospinal fluid, CSF, D, disc space, C, spinal cord, D, vertebrae. All right, the correct answer is A, cerebrospinal fluid. Question 41. Which anatomy structure is the arrow pointing to? A, anterior cruciate ligament, B, anterior longitudinal ligament, C, posterior cruciate ligament, D, posterior longitudinal ligament. All right, the correct answer is B, anterior longitudinal ligament. The anterior cruciate ligament, also known as the ACL, and the posterior cruciate ligament, PCL, is found in the knees. So just keep that in mind. Question 42. Which anatomy structure is the arrow pointing to? A, anterior cruciate ligament, B, anterior longitudinal ligament, C, posterior cruciate ligament, D, posterior longitudinal ligament. And if you all was paying attention to the last question, I think you can get this answer right. All right, the correct answer is D, posterior longitudinal ligament. And just remember the ACL and PCL ligament is found in the knees. Question 43. A small coil will provide a decrease in SNR, B, an increase in SNR, C, more aliasing artifacts, D, more sensitivity to artifacts. All right, the correct answer is B, an increase in SNR. Question 44. A decrease in number of signal averages NSA will A, decrease the field of view, B, decrease scan time, C, increase signal averaging, D, increase scan time. All right, the correct answer is B, decreased scan time. Question 45, a decrease in TR will A, decrease field of view, B, decrease scan time, C, increase field of view, D, increase scan time. All right, the correct answer is B, decrease scan time. Question 46, an increase in field of view will A, decrease the signal to noise ratio, B, decrease the TE, C, increase the signal to noise ratio, D, increase the scan time. All right, the correct answer is C, increase the signal to noise ratio. The easiest way I remember because these last few questions I just went over are parameters, and that's very important to know. So what helped me remember it the best was, of course, just rereading it, but secondly, me actually seeing it adjust and how it was changing and affecting each other on the actual scanner. So if you're still studying for your test and you're working or you're doing clinical, look at how look at what happens whenever you are adjusting the parameters on the scale on the scanner, and it probably will help it stick better as well. Question 47. An increase in TE will A, decrease T2 contrast, B, increase SNR, C, increase T1 contrast, D, increase T2 contrast. All right, the correct answer is D, increase T2 contrast. Question 48. Which anatomy structure is the arrow pointing to? A, capitate, B, lunate, C, radius, D, scaphoid. All right, the correct answer is D, scaphoid. Question 49. Which anatomy structure is the arrow pointing to? A, capitate, B, lunate, C, radius, D, scaphoid. All right, the correct answer is B, lunate. Question 50. We're halfway there. So I don't know. I want to see who all made it all the way to 50 questions. So if you made it to 50 questions, and if you're seeing this right now, put that emoji in the comment box whenever you are like congratulating someone where, is blowing out the little thing. I can't think of it. 50 questions in, I'm stiff right now. But question 50, which anatomy structure is the arrow pointing to? A, capitate, B, lunate, C, radius, D, ulna. All right, I'm sure that's probably an easy question for you all. So the answer is C, radius. If you made it this far in the video, put a brain emoji in the comment section because you are halfway there. Now we have 50 more questions to go, so you got this. So you can put a brain emoji in the comment box. You can put like one of those congratulations emoji where it have like the little sparkles or whatever coming out. So either one is fine. It just let me know like if you made it this far in the video. All right, so question 51. Which anatomy structure is the arrow pointing to? A. Achilles tendon. B. Anterior cruciate ligament. C. Flexor tendon. D. Rotator cuff tendon. All right, the correct answer is C. Flexor tendon. Keep in mind that the Achilles tendon is down there by your ankle and leg area, your ACL is in your knee, and your rotator cuff is in your shoulder. So just keep those in mind. Question 52. Which anatomy structure is the arrow pointing to? A. Capitate. B. Radius. C. Scaphoid. D. Ulna. All right, the correct answer is D. Ulna. Question 53. Which artifact is caused by radio frequency interference that enters the MRI scanner room? A. Alicing artifact. B. Cross excitation artifact. C. Crosstalk artifact. D. Zipper artifact. All right, the correct answer is D, zipper artifact. So the best way to avoid this type of artifact is to keep the MRI scanner door closed while you are scanning your patients. Also, if you do not see a lot of artifact questions in this video, it's because I've already made a full video just about artifacts only. I do have more in this video, but just in case you don't see all of the artifacts in here, that's why. Question 54. The time between the RF excitation pulse is called A. T1, B. TI, C. TR, D. TE. All right, the correct answer is C. TR. Question 55. The time that it takes for 63% of the transverse magnetization to decay is called A. TR, B. T2 decay time, C. T1 recovery time, D. Time from inversion TI. All right, the correct answer is B. T2 decay time. This is also known as spin-spin relaxation. Question 56. A dephasing due to the magnetic field inhomogeneities is called A. T1, B. T2, C. T2 star, D. TE. All right, the correct answer is C. T2 star. Question 57. The time between each excitation pulse is called A. T1, B. T2, C. TR, D. TE. The correct answer is C. TR. Repetition time is the time between each excitation pulse. Question 58. Which imaging plane is shown below? A. Axial, B. Coronal, C. Oblique, D. Sagittal. All right, the correct answer is D. Sagittal. This is a sagittal MRI shoulder. Question 59. Which anatomy structure is the arrow pointing to? A. Coracoid process. B. Glenoid process. C. Greater tubercle. D. Lesser tubercle. All right, the correct answer is B. Glenoid process. Question 60. Which anatomy structure is the arrow pointing to? A. Deltoid muscle. B. Infraspinatus muscle. C. Subscapularis muscle. D. Teres minor muscle. All right, the correct answer is B. Infraspinatus muscle. Question 61. Which anatomy structure is the arrow pointing to? A. Acromion. B. Greater tubercle. C. Lesser tubercle. D. Coracoid process. All right, the correct answer is B. Greater tubercle. Question 62. The normal operating mode for whole body specific absorption rate or SAR is A. 1 watts per kilogram. B. 2 watts per kilogram. C. 3 watts per kilogram. D. 4 watts per kilogram. All right, the correct answer is B. 2 watts per kilogram. Question 63. Which MRI zone is for screening MRI patients, reviewing surgical history, and answering the MRI screening questions? A. Zone 1. B. Zone 2. C. Zone 3. D. Zone 4. All right, the correct answer is B. Zone 2. Question 64. Which MRI zone has a locked door and is restricted to screen and trained personnel? A. Zone 1. B. Zone 2. C. Zone 3. D. Zone 4. All right, the correct answer is C. Zone 3. Question 65. Which MRI zone is the tech workstation is located in? For an example, this includes the tech work area, MRI computer for scanning, etc. A. Zone 1. B. Zone 2. C. Zone 3. D. Zone 4. The correct answer is C. Zone 3. Question 66. Which imaging plane is shown below? A. Axial. B. Coronal. C. Oblique. D. Sagittal. All right, the correct answer is A. Axial. So this is an axial shoulder. Question 67. What does the symbol below means? A. MRI compatible. B. MR conditional. C. MR safe. D. MR unsafe. The correct answer is B, MR conditional. Question 68. Anatomy that is outside of the field of view that wraps inside of the field of view is called A, aliasing artifact, B, cross excitation artifact, C, crosstalk artifact, D, shading artifact. All right, the correct answer is A, aliasing artifact. Increasing the field of view and phase over sampling will help avoid the aliasing artifact. I normally see these artifacts on the brain, of course, where the nose is wrapping into like the back of the image. I see this on foot or feet, and of course abdomen. So these are where I commonly see this at. Question 69. Which anatomy structure is the arrow pointing to? A, kidney, B, liver, C, spleen, D, stomach. All right, the correct answer is C, spleen. Question, this says 69, but I think it should be 70, but you all have like a bonus question. So question 69, which anatomy structure is the arrow pointing to? A, aorta, B, inferior vena cava, C, pulmonary artery, D, superior vena cava. All right, the correct answer is A, aorta. And if anyone asks why she just didn't change the number, that's because if I would have changed the number on this slide, I would have had to go back and change the number on the other slides. And I've already spent like 8 hours doing this, so I don't want to spend 30 more minutes editing. But anyway, question 70. Which anatomy structure is the arrow pointing to? A, kidney, B, liver, C, spleen, D, stomach. All right, the correct answer is B, liver. I'm sure you all are pretty good on your anatomy, but just let me know in the comment box if you have trouble with your anatomy or if it's mainly just physics. Question 71. Which anatomy structure is the arrow pointing to? A, kidney, B, gallbladder, C, pancreas, D, stomach. All right, the correct answer is C, pancreas. Question 72. Which anatomy structure is the arrow pointing to? A, kidney, B, gallbladder, C, spleen, D, stomach. The correct answer is A, kidney. The arrow is pointing to the left kidney to be exact. Question 73. A spin echo pulse sequence uses a 90-degree RF pulse followed by 90-degree RF pulse, B 90-degree RF pulse followed by 180-degree RF pulse, C 180-degree RF pulse followed by 90-degree RF pulse, D 180-degree RF pulse followed by 180-degree RF pulse. All right, the correct answer is B, 90-degree RF pulse followed by 180-degree RF pulse. Question 74. An inversion recovery IR spin echo pulse sequence begins with A, 0-degree RF pulse, B, 90-degree RF pulse, C, 180-degree RF pulse, D, 360-degree RF pulse. All right, the correct answer is C, 180-degree RF pulse. Question 75. So after this, we have 25 more questions to go. Here's a fun fact. I am pretty stiff right now because I have not gotten up and taken a break. I did this video for the CT registry that I did, and everyone enjoyed it. So I said, let me just throw this one in for MRI. So I hope you all like it. I did spend a lot of time making this video. But question 75, which imaging plane is shown below? A, axial, B, coronal, C, oblique, D, sagittal. All right, the correct answer is A, axial. Question 76. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery, B, anterior communicating artery, C, basilar artery, D, superior cerebellar artery. All right, the correct answer is A, anterior cerebral artery. Question 77. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery, B, basilar artery, C, left internal carotid artery, D, left vertebral artery. All right, the correct answer is D, left vertebral artery. Question 78. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery, B, basilar artery, C, right internal carotid artery, D, right middle cerebral artery. All right, the correct answer is C, right internal carotid artery. Question 79. Which anatomy structure is the arrow pointing to? A, anterior cerebral artery, B, basilar artery, C, right internal carotid artery, D, right middle cerebral artery. All right, the correct answer is D, right middle cerebral artery. Question 80. Which anatomy structure is the arrow pointing to? A, left atrium, B, left ventricle, C, right atrium, D, right ventricle. All right, the correct answer is, I'll give you 5 more seconds. B, left ventricle. Question 81. Which anatomy structure is the arrow pointing to? A, left atrium, B, left ventricle, C, right atrium, D, right ventricle. All right, the correct answer is D, right ventricle. Question 82. Which anatomy structure is the arrow pointing to? A, interventricular septum. B, left coronary artery. C, right coronary artery. D, sagittal sinus. All right, the correct answer is A, interventricular septum. Question 83. Which anatomy structure is the arrow pointing to? A, ascending aorta. B, descending aorta. C, inferior vena cava. D, superior vena cava. All right, the correct answer is B, descending aorta. Question 84. T2 contrast is controlled by A, T1, B, TI, C, TE, D, TR. All right, the correct answer is CTE. Question 84. I think this should be 85, but I'm telling you all, it took me a long time to work on this video because I made the questions and answers all by myself. And then I'm also doing this around my work schedule. So I enjoy doing this, but just in case you catch like minor mistakes like that, that's why, because it just took me a long time and now I can't go back and edit it because it's gonna take even longer. It's just gonna throw off the questions. But question 84, at least you got two bonus questions. T1 contrast is controlled by A, T2, B, TI, C, TE, D, TR. All right, the correct answer is D, TR. Question 85. A defect in the pars interarticularis is called A, spinal stenosis, B, spondylosis, C, spondylolysis, D, spondylolisthesis. All right, the correct answer is C, spondylolysis. Question 86. Which anatomy structure is the arrow pointing to? A, C1, B, C2, C, C3, D, C4. All right, the correct answer is B, C2. Question 87. Which anatomy structure is the arrow pointing to? A, disc space, B, pedicle, C, Spinous process, D, vertebrae. All right, the correct answer is C, Spinous process. Question 88. Which medication may be given to claustrophobic patients for their MRI scan to control their anxiety? A, benzodiazepine, B, diphenhydramine, C, prednisone, D, Zyrtec. All right, the correct answer is A, benzodiazepine. So that is pretty much um, like your Ativan. So that's what that is. Question 89. The largest portion of the brain that is divided into left and right cerebral hemispheres is called A, cerebellum, B, cerebrum, C, pons, D, thalamus. All right, the correct answer is B, cerebrum. Question 90. We have 10 more questions left. So hand clap to anyone who's made it like all the way through. How many lobes are in the brain? A, 1, B, 2, C, 3, D, 4. All right, the correct answer is D, 4. You have your frontal lobe, parietal lobe, temporal lobe, and occipital lobe. Question 91. The brain stem consists of all of the following except for the A, medulla oblongata, B, midbrain, C, pons, D, thalamus. All right, the correct answer is D, thalamus. The brainstem consists of the medulla oblongata, midbrain, and pons. Question 92. Which gland is sometimes called the master gland because it controls the functions of other glands? A, pineal gland, B, pituitary gland, C, thymus gland, D, thyroid gland. All right, the correct answer is B, pituitary gland, which produces and releases hormones that control the growth and functions of other endocrine glands. Question 93. Which cranial nerve is responsible for hearing and sound? A, 6, B, 7, C, 8, D, 9. All right. The correct answer is C8. Cranial nerve 8 or vestibulocochlear is responsible for sound. So if I was you, I would know the cranial nerve number as well as the name for that number because you just don't know like how it's going to be asked. Question 93. Which cranial nerve controls the eye movement? A1, B2, C3, D4. All right, the correct answer is C3. Cranial nerve 3 or oculomotor nerve is responsible for controlling the muscles that move your eye. Question 94. Which anatomy structure is the arrow pointing to? A, femur, B, fibula, C, patella, D, tibia. All right, the correct answer is C, patella. Question 95. Which anatomy structure is the arrow pointing to? A, anterior cruciate ligament, B, popliteal artery, C, popliteal vein, D, posterior cruciate ligament. All right, the correct answer is A, anterior cruciate ligament, also known as the ACL. Question 96. Which anatomy structure is the arrow pointing to? A, femur, B, fibula, C, patella, D, tibia. All right, the correct answer is D, tibia. Question 96. Which anatomy structure is the arrow pointing to? A, anterior cruciate ligament, B, patellar ligament, C, popliteal vein, D, posterior cruciate ligament. All right, the correct answer is B, patellar ligament. Question 97. Patients, visitors, and any staff members that does not have formal MRI safety training is considered A, non-MRI personnel, B, level 1 personnel, C, level 2 personnel, D, level 3 personnel. All right, the correct answer is A, non-MRI personnel. Question 98. Staff members and MRI tech assistants that has passed the minimum safety education to work in MRI Zone 3 is considered A, non-MRI personnel, B, level 1 personnel, C, level 2 personnel, D, level 3 personnel. All right, the correct answer is B, level 1 personnel. Question 99. MRI techs, radiologists, and nurses that have been trained in MRI safety would be considered A, non-MRI personnel, B, level 1 personnel, C, level 2 personnel, D, level 3 personnel. All right. The correct answer is C, level 2 personnel. Last question. So if you made it this far, could you please put like the 100 emoji, the one like red and italicized, or put like 100 in the comment box for me so I can know that you watched all the way to the end and made it this far. Which element is the most important in MRI for creating the images? A, carbon, B, hydrogen, C, oxygen, D, sodium. All right, the correct answer is B, hydrogen. All right, so thank you all so much for watching to the end of the video. Leave me a comment. Let me know how far did you get in the video. Would you like a part two? If you do want a part two, it doesn't necessarily have to be 100 questions. I can do 75. I can do 50. But if you do want another like set of 100 questions, just let me know. I just did 100 questions because someone left me a comment and they was like, "Hey, you should start selling your questions in a PDF form or file." And I was like, "Okay, let me do a poll to see how many people would buy it because if a lot of people won't buy it, then I'm not gonna, do the put the questions in a PDF file. I can just keep it on here." So a lot of people voted to just have the questions on here. So that's why I'm just keeping it on here. Also, that's why I did 100 questions because that person kind of like wanted like a lot of questions in like a PDF file. And then also leave me a comment and let me know when you are taking your registry exam. All right, so if you enjoyed this video, could you please give it a thumbs up for me? Also hit the subscribe button and you can leave a comment. Like I was saying, it did take me a lot of time to make this video. I enjoyed it. I had fun. But the way you can show your appreciation is if you just give the video a thumbs up, especially since it's free. You cannot argue with anything that's free. But anyway, thank you all so much for watching. Good luck on your test. I hope that you all pass. Let me know if there are any more videos that I can get out for you. But please check the playlist first because I have a lot of MRI registry videos already in my playlist. So you may can find what you're looking for in there. If not, just comment below and I can make more. All right. Thank you all so much for watching and good luck. Bye.